Well, thank you for joining our monthly webinar. As of next year, are going to start running 2 webinars a month. We are having lots of inquiries and lots of people asking whether they can join and different times. So we're going to put a second one on to make sure that everybody can join, essentially. The one today is for our Docman filing product. Which is obviously for Docman. And what I'm going to do today is just to quickly run through in the same format as previous webinars, who we are, why we exist, what we do, what the product does, the problems that it's solving, although everyone on this call will already have an understanding of why they want to automate Docman, costings, templates, and how to proceed if you're interested in moving forwards. The MyBotGP range are downloadable automated products, and this is the reason why they become so popular. MyBotGP for Docman is used in the same way and downloaded in the same way as our other products. So for EMIS, we currently have live a normal pathology filing product, which we have some clients using to filter on over 131 different pathology tests. Obviously, within that, there are, with some pathology tests, you can have up to 8 or 10 subtests. So there's probably 200 to 350 different pathology tests that is now managing. And we also have a repeat prescription MyBotGP, which will support the repeat prescription process as well. I'm going to try and make this box smaller. That's better. Today, all of our products are downloadable. So the best analogy for them is an app on your phone or on your computer. It can live on a computer at the practice, a spare computer, or it can live in a hosted machine, in a server somewhere, depending on what you have access to or what you prefer. And we will soon have a hosted offering live for our products as well. The way that they work is they are literally a 10-minute download. It's then connected to EMIS or Docman, depending on the product that you've taken. It will learn for a couple of days, and by learn, I don't mean it's got some kind of funky AI. What I mean is it's going to read all of the letters in this scenario, save them in the memory, and then a couple of days later, you will sit there and tell it what to do with each one of those letters. So you have a product which is downloaded very quickly within about 10 minutes and can be live and operational within a couple of days. And then each day you'll get an audit log and so on and so forth. So the format for today, as per the agenda that I sent out, skim over why MyBotGP is essentially what it is and what it does. Time saving, where does it live, which I've touched on. How does it know what to do with your letters, which is very important. Around templates, can it use templates, and how does it triage? Is there an audit? And then at the end, as with all of our webinars, we'll leave time for a Q&A. So please feel free to put questions into the chat. Sandra will look after those, as well as supporting me with any questions around functionality, and then hopefully at the end of the webinar we'll have enough time for a good conversation, for some Q&As to come backwards and forwards that we enjoy answering, and then anything that we haven't covered, please feel free to reach out to us by email or call afterwards, and we can answer those questions as well. As with all of our webinar attendees, we will share this with you afterwards with some decks, and we usually share a link to a page which will give you a slight discount if you would like to proceed with the purchase straight afterwards, and that will come within the next couple of days. Okay, so we still have a few people joining. So pleased to confirm that we were part of an NHS Health Innovation Launchpad program, which is funded by the NHS and local government for launching new technology in all areas of the NHS essentially, and in our scenario it was primary care, and MyBotGP was part of that program because of its bespokeable nature and the challenge that we've tried to solve in primary care. So I'm going to move, can you move Sandra's picture a bit to the side here, and I'm going to run through this presentation. You've had it before. We will also show you a couple of demos as well. So obviously these are clinically driven automations. So what does that mean? Well, that links to this thing here. It's super important if you're doing research in this area. Our tool has a DCB 0129. A DCB 0129 is an NHS required certification. And the way to get that certification is we have a clinical safety officer who's a clinician who's done additional safety training, who has certified this tool as fit as it works. Your responsibilities when using any type of IT at practice level obviously kick into play, whereby how you want to monitor the looking after of this tool, how it's audited and reconciled. And again, that's conversations for another day, but there are NHS guidelines for you to follow where appropriate. But from our side, what we have to do is to validate that the tool is safe, it works. If we say it can read letters, it should be able to read letters. If we say it can send those letters, it can code them, it can complete templates, it can supersede IntelliSense, it can be triaged to appropriate people. It has to be able to do that, and obviously that certification shows that it does. We've got a very strong track record at working in primary care. What does that mean? Well, what it means is we're very used to working with practices on their own, PCNs as a group, federations and ICBs. And that's really the premise of where MyBotGP came with. You all do the same thing in a different way. You will all have your own protocols and flows internally at practice level as to how you disseminate your letters, what letters you get, where you send them, who sees them, what letters you don't need to see, whether you're going to triage stuff to pharmacy teams, directly to clinicians, to coding teams, how capable those coding teams are, and whether you want to put in folders, in boxes, in emails. You will have all built out your own protocols. So one of the beauties of and the strength of MyBotGP is that it can be dropped into your practice, and you can replicate those flows if you like. Think of it as a person that you've employed. You've given it permission to go through your letters. You've told it how to validate your letters, and you told it where to send them afterwards and what to do with them afterwards. No different to onboarding a new person, except for this one will work 24/7, 365. And if you show it how to do something once, it will always do it that way. It won't make a mistake. So what that means is, and more recently, I'm pleased to confirm in the last year or so, we've started to work with a lot of PCNs making acquisitions for 3, 4, 5, 6, or even 8 different practices, because they can buy it once and everybody still gets their own copy. So no one's being told that they need to change any protocols at practice level. MyBotGP will slip into yours, and that's a big thing. We're experts at working with Docman, obviously, that goes without saying. And coming back to the points I touched on before, we can share DPIAs and data sharing agreements where appropriate, but needless to say, we have that. So here's the challenge at the moment, and I'm actually going to revise that figure. More recently, we are being told that figure is more like 120. So you're looking, and again, that will change from the demographic of the patients at the practices. So some patient demographics will receive more letters, some will receive less letters. But on average, a practice with an 8,500 list is receiving about 120 letters a day. So that's actually a staggering 37,440 letters a year on average, every year. For those of you on this call, you're aware that the letters just keep coming. All of them need to be picked up, validated, entered onto the system, coded and triaged to the appropriate people, obviously as quickly as possible. So you have teams of people, be it 2 people or 4 people or 5 people, depending on the size of the practice, that are doing that to the best of their ability. So it's about 37,440 letters a year for an average size practice with an 8,500 list. And MyBotGP will do this for you. This is the logic of the tool. As with all of our tools, it has a very clear functionality of where it starts and where it stops. And I'll go through that in more detail in a moment. Multiple letter types have different actions, predefined actions. This work is extremely important and time consuming and error prone. And invariably you have highly skilled people in these teams who are doing a lot of cut and pasting and double checking and filing and triaging, quite frankly, work that is below them. and there's probably a lot of other stuff that they could be doing in the meantime. So if you could free up large chunks of their time, so they're just focusing on the important stuff, i.e. reading blocks of free text and making decisions around patients from the actual letters, that's only going to add value. We work with all different types of practices. Some have run out of room. Others can't recruit. Others are struggling to maintain support desks. Others just can't cope with the letters. And we know, whilst we're not going to talk about numbers on this call, but we do have clients who, before we started working with them, and regularly speak to potential clients who have backlogs, and some of those backlogs can be quite significant. You're looking at about, and that's based on 105 letters, somewhere in the region of 1,700 or 1,900 hours of physical time and cost a year could be saved. Increased resilience. Don't have to worry about people being ill or leaving or holidays, and you're freeing experts' time. Everyone's got a very strong background in primary care, many years of experience, and you'll be able to start to leverage that experience again when you remove the mechanical side from their role of cutting and pasting and reading and forwarding. So here, coming back to the areas we've touched on again. So what does it do? Well, MyBotGP for Docman has a very clear remit in as to where it starts and where it stops. And again, please feel free to put questions in the chat. We'll come back to them later. I can't see them at the moment, so we'll go through all those at the end. What does it do? It takes control of the entire administration process for you. What does that mean? Well, it means it works with or without IntelliSense. That's important. So if you're using IntelliSense, it will use it and supersede it, and it can file, and it will double check for you. If you're not, then it still works. It will work with Docman. For those of you who aren't using Docman, obviously this tool isn't for you. And periodically we have inquiries from practices that want to buy it, but they're not using Docman. So just to put that clear here, this is a Docman automation product that can work with or without IntelliSense. It operates securely with dual login, which is a new NHS. Well, earlier this year, it's a prerequisite, i.e., no one can just log into it once. It will send an email to validate that is correct, which is ensuring increased security, and it's available to work 24/7, 365. So what does that mean? It means you can set a schedule. You can run it whenever you want. So we have some clients let it run for 3 or 4 hours and then stop, give it a break. They might then turn pathology filing on, then it will file their pathology test for them, then it will go back and it will run Docman again. If you just have Docman, you can leave it run all the time. If you have 3 products, you rotate it between the 3. But again, what we're saying is this is a machine, so it will go at night, it will run on the weekend. If you have a backlog, it will be able to churn its way through the backlog. If you don't, it's going to ensure that everything is at 0 at the end of each day, and that when you come in on a Monday morning, everything is already updated onto the system, filed, and just left for a human to double check and go through and disseminate where appropriate, depending on how you set up your flows internally. No more mistakes. Doesn't make mistakes. What does that mean, and why do we put that there? We put that there because when you tell it what to do with a letter for the first time, and again, this is some pretty obvious stuff, but it's stuff that does need to be said. Make sure that you have someone with the relevant experience telling it what to do with the letter each time, because it will always do that. So moving forwards, if you use the correct person to code it, how to validate each letter, it will always do that. We work on a subscription basis where we have unlimited pages and unlimited letter types are included at no additional cost. It's quite important as well. So there's going to be no surprises and increases. So it's a generalized subscription. It connects directly to Docman and manages all incoming letters, reads PDFs, scan copies, and NHS mail. So some of the questions we're asked fairly regularly is what about stuff that's scanned in by hand? That's not a problem. So anything that you receive will be fed directly into Docman in the normal manner, and then it will kick in and take over the management of those tools. If you're using templates, it will use the templates. So there's no fear around well, not being able to leverage the templates and some of the complex protocols that you've built out. It's just like a person. It's got a very, very specific remit. So this is the template this is the Docman template that you're all filling in. Sometimes this, if you're using IntelliSense, obviously this will be pre-configured to a point where it needs to be double checked and filed. So again, it will supersede that. But essentially what happens, and I'll show you in the demo in a moment, MyBotGP will pull up the letter, it will read the letter, and it will pre-populate it for you. You then look at that. Has it got it right? If it's got it right, yes. If you need to make a couple of amendments, you make the amendments there, save it, and then it won't ask you a second time. So you only tell it what to do with the letter once. Second time, and then you save it in the memory. Second time it sees that letter, it won't ask you. It already knows, and it will file it. So over a short period of time, it's taking more and more of the letters from you. And each day you show it how to recognize several more letters, and then it won't ask you for a second time. If it sees a letter for the first time, it could be a hospital has got 3 different iterations of the same letter. It will treat each one individually. It will double check with you and say, is that that? Yes, it is. Save it. Second time, it will push it through the system. So the way our clients go live is they generally pick the letters that they've decided that don't need to be seen by anyone and can be filed with no action straight away first, and the ones with the highest volume. And we will help them code those in. It takes about a minute or 2 per letter to code them in once. And we usually code in the first 20-25 letters, something like that for you. Put you through a bit of training. It's not complicated, but like anything, you know, like using a new phone, for the first few times you use it, it looks complicated, and then you get your head around it, and it really isn't. So it will validate the letters in the same way as a person, validate the patient with the NHS number. You tell it where to look for the NHS number, and complete the template and validate the NHS number. You validate the document in the same way a person does, i.e. diabetes or cardiology. It will also categorize the letter and complete all of these fields accurately each time. When you say categorize the letter, it's going to validate the event date. You know, do I need to look in the top left-hand corner or top right-hand corner, or should I ignore the dates in the top and look for a date in the middle of the page? Because for that particular letter, you need to look at the date in the middle of the page, not in the top of the page. You're telling it, you're teaching it how to recognize that particular letter and saving it in the memory. Department, organization, hospital, clinical codes categorize the letter, so you can code the letters. Of course, you can code the letters. However, the diagnosis piece is left for the people. But however that wants to be picked up, that can be triaged to an appropriate folder or person, whichever way. But that's the only piece that they're left doing. You can create reviews, complete all of these 12 tasks. The letter will be pushed onto the patient record, so it's filed. It's on the patient record, and you can assign the letters wherever you want to. So think of the final piece as a roundabout in the same way as a person, but that roundabout will pick up a letter and say, oh, that's for this team, or that's for that team, or that's to be put in that folder because those people need to look in that folder on a regular basis. And it will just keep reviewing, uploading, filing, validating, triaging, so constantly in the background. So saving you anywhere in the region of 1 to 2 minutes per letter. 1 to 2 minutes per letter on an average size practice is 37,440 times 2 minutes, which is a lot of time. People aren't machines. Sometimes you might code a couple of letters in, 2 letters in a minute, or 2 letters in 2 minutes. But no human being can do 130 in I don't know, 70 minutes or 65 minutes. It's just in an hour. It's physically not possible. Whereas MyBotGP will just plow its way through them. Before we move on to the demo, this is another really important thing to share here for those of you that can see the screen. This is the audit log. So one of the most important things and value adds that this type of technology starts to offer you is the physical ability to have a record of everything that you've done. So there's no mystery around what letters came in, what was done with them, where they were filed, dates, times, so on and so forth, because now you have a machine doing it that will give you a report. Now this report is emailed to you every evening. There's also a full log inside MyBotGP as well. So there's no mystery. You can go back at any point. Everything is accurate. Just let this person in. Everything is accurate, and it's done by date, by document category, and then there's a detailed data view of filing granular breakdown. So just a snapshot of this page, it's telling you what it's seen, what it's filed, and it's also telling you what it's seen and it hasn't done anything with because it hasn't been given permission to. So in the scenario at the bottom, you would say, okay, fine, it's done nothing with these because it's not been given permission. Okay, no problem. We'll open it up, give it permission to recognize that letter. It will show it on a pre-populated template within MyBotGP. Tell it how to recognize the letter, save it in the memory, and then that will disappear from that list. So over a few weeks, what you'll see is that list getting smaller and smaller and smaller. And then invariably what you'll do at practice level is watch the audit logs to pick up new letter types that you haven't seen before, or changes in letter formats, add them to the system, and it will continually add them on. So what you're doing at team level is you're saving all of the time of getting them on the system, validating them, double checking them, triaging them to the appropriate people, and coding them. And the role will change to around coding, medically coding. Obviously, the letters are coded, medically coding, or triaging to the appropriate people, and double checking the audit logs to add more letters in. So your helper can just continue to beaver away in the background, processing everything. So I'm going through quite a lot of information here. I appreciate that. And again, if you have queries, please pop them in the chat. If not, we can come back to them afterwards. Costings are really straightforward. Unlimited pages and unlimited letter types, and we work on an annual subscription, and training and support is included. This is a SaaS product, software as a service, so we look after it for you. We charge $4.99 for MyBotGP, and then we charge 30 pence times the patient list, and the rough calculation is there. An 8,000 list would be 499 times 8,500 times 30 pence, which is 2,550, which is a total of 3,049 plus VAT a year. All our products are charged in the same way: pathology filing, Docman, repeat prescriptions. We've kept the pricing lean because we're hoping you'll be really happy and take a second product and maybe a third product as well. So it's quite straightforward, not an overly complicated product pricing scheme. So what I'm going to do now is I'm going to move to the demos. The demos are here. Open up my folder to this one, and I will run them one by one. And what I like to do at this point, otherwise everyone only hears from me, is hand over to Sanj, who will go through what this means here. Now, just before I hand over to Sanj to talk this through, I just want to explain the premise of this demo. So in reality, our tool will pre-populate these for you in advance. You don't need to complete them anymore. You just need to agree with them. However, for demo purposes, that's quite difficult to show. So what we've got is we're actually pre-populating these for you. Also, one of our clients was kind enough to let us use their Docman and some of their letters for the flow, on the basis, obviously, that it's been anonymized. So you can see this is redacted. So it's redacted because this is with a live client. So I'm going to go on mute, and then I will start and stop when I'm told to start and stop for the next 5 or 10 minutes, and then we can move on to questions. So Sanj, over to you.
Thank you, James. Okay, so the Docman filing tool. So as James said, the way the system works is we set it up, we let it run for a day or so, and it will grab all of your documents within Docman. It automatically grabs all of the document types. Now, as you can see in the top left-hand corner, you can start to see that the application has actually seen a number of documents like dermatology and general clinic letter and so forth. So that piece is actually already automated. This was a kind of a new change that we implemented, which prior you had to actually download the documents manually within Docman and then upload them into the system. But now that's all gone away. MyBotGP simply logs onto Docman, grabs all of your document types and presents them to you. And then what we need to do is train MyBotGP. And once you've trained MyBotGP once, it will never have to be trained again regarding that letter. Now, as James has said, this is going for the administrative piece. So in summary, what we are trying to do, or what we are doing, is you need to tell MyBotGP the classification of that letter. So give that letter a document type, for example, dermatology, oncology, emergency discharge, NHS mail, neurology. So essentially, once you've classified that letter, we are then able to tell MyBotGP what are those fields that James showed within Docman. Things like tags, person, create review, department, clinical code, all of those fields, the manual stuff that the teams are doing, that are typing in, copying and pasting every day per letter. So this is coming back to the actual sort of training piece. This is a one-off process that one needs to do per document, and once it's done, it never has to be done again. What MyBotGP will do then, we'll show you another demo. It will log onto Docman automatically. It will log onto it'll filter to not in folder. And then it will start to look at each letter that you've trained it on. So it will see a dermatology letter. So, okay, I found that letter. I know the fields that you've told me as per the training. It will then start to populate those fields and complete the filing for that letter. It will then go to the next letter, etc., etc., etc. So what we're going to do is show you how easy it is to train the actual letters. Now, the first thing it's going to ask me to do is to give it a document type. So you simply type in the letter, type in the actual name that I'm going to give this. So I'm going to call this an ENT letter, okay, ENT clinic letter. So now every time MyBotGP sees this letter, it knows it's going to be an ENT clinic letter. Now, how does MyBotGP know that that's the actual document type? Well, simple. You tell it the keyword to search within the document title. So again, just play that on. So within Docman, I'd like you to type in the word ENT clinic letter. So it will filter on the ENT clinic letters within Docman. Now, the second thing that you need to tell it is how to identify the actual letter on the screen in terms of that piece of paper. So you simply have to tell it a keyword to search within the document. So again, ENT clinic letter. Now, just to sort of summarize what we've done is we've classified the letter as ENT clinic letter. We've said, okay, within Docman, you can find that letter by simply typing in the word ENT clinic letter within the actual search bar within not in folder. Okay. Now, within the actual letter, I want you to find the keyword ENT clinic letter, and that's the link between the three. Okay. Now, this will become more apparent as we go forward. So now we've got a link between document type, how to find it in Docman, and actually how to find it within the actual letter. Okay, so let's go on. So the next thing I'm going to do is step 2. There are 5 steps one needs to complete. So again, as you can see, there's a sort of a highlighting a piece of functionality there that you're telling it where to pick up NHS number. We then tell it the event date. So again, just pause it there, James. So as you know, there are a number of options one can decide. Do you want the event date to be current date? Do you want it to be a calendar date? Do you want it to be anywhere on that letter? So you've got the ability to essentially decide how you want to determine event date based on that letter. It's very sort of freestyle in terms of its drag and drop. You can see that those blue boxes are drawn by you with your mouse, and then it automatically extracts that information for you, and you simply have to click save if you're happy with the results. Thank you, James. Just scroll along. So for this one, we're going to say use current date. The next one, organization. Again, interestingly enough, all you need to tell MyBotGP, just pause it there. So again, what you need to tell MyBotGP is a list of all the hospitals, the organizations that you're going to be expecting letters from. So that's just a real basic list of 5 or 10 or 15 hospitals that one needs to apply. It's a simple table that you just type in all of the organizations. Now, department. Again, what's the department I would like to map this ENT letter to? So again, for this one, I've left that as is. Description. Again, you can put custom text, you can leave as is. It's your rules, by the way. This is how you want to file your letters. So this is coming back to what James has said. This is self-configurable. It's based on how you do your filing today. So it's really horses for courses. How you just pause it there, James. So yeah. So again, things like folders, tags, persons, create reviews. Everything is how you want to file. But the most important thing here is you're standardizing the approach based on that letter type. Okay, so for this one, again, I could create tasks for this particular letter. You can then start to cipher off, letters of more importance and create specific cues for those letters, or create, tasks for those letters based on the create review. Okay, so just roll it on, James. Again, so, create review, I've just left that as is. Clinical code, I can select the clinical code. And then person, again, you're telling MyBotGP what to populate within Docman. Once that's all done, so you can see now that's step 5 of 5 completed. Now, this is very obviously, it's completely aligned with the Docman fields, as you can see. Now, I've trained that document, it's all done. So every time now MyBotGP sees that letter, it knows how to filter it in Docman, it knows how to identify that letter, and more importantly, it knows what fields to populate for that letter, which the team are manually doing per letter. It then is, again, the next piece is to obviously, do the actual coding of that letter.
Sanj, just want to quickly touch on templates, because a question we're asked a lot.
Yeah, 100%. So template. So all you need to do is select the actual template. It will then you tell it the template that you would like MyBotGP to select, and you type in the actual name of that template against that document, and it will simply select. It's no different to a person. MyBotGP is exactly like a person. You are training MyBotGP to action your rules and how you want to run your filing. Okay, so as we can see here, I think James has just started will actually run the demo. And really, it's no different to a person. It's going to log on to Docman, MyBotGP. It's going to navigate to the not in folder. Okay, we can just see here.
I'll just jump in for a second.
Sure.
So the way that it interacts with your system, so before we run it, so you can see that we've called it robot, generally you give it a proper name. It needs its own username and password. So think of it as as Sanj was saying, everything is exactly the same as a person. So it needs a username and a password so it can access Docman. It will have permissions only to access what you give it to. So it can only access Docman. It can't just start accessing or looking around in different places, in the same way as if you configure access for a person. And where does it live? Going back to something that we touched on at the beginning of the call, it lives on a computer. It lives on a hosted machine, or it can live in a server, or it can live on a practice machine. Again, this is up to you. There are, we follow your lead. But in principle, it can live anywhere. So it lives anywhere, and it has an account, and it's got its own username and password, and it's got permissions. So there's a full audit log, and it's locked down in terms of what it's able to do. So what you're seeing here now, and I'll pass back to Sanj in a moment, is it's on a computer. It's 1 o'clock in the morning, or it's Sunday afternoon, or it's 2 o'clock in the afternoon during the week, or it's whatever time you wanted it to wake up, unless you want it running all the time. It's switching itself on. It's logging in with its unique username and password and its ID, and it's going to go into Docman, and it's going to go find the letter, look through all of the letters, pick out the ones it's got permission to action. It's going to action them. It's going to complete the templates. It's going to triage them, code them, set tasks, reviews, whatever you want it to do for that individual letter, and it's going to move to the next, to the next, to the next, to the next, to the next. And every time it sees one it's never seen before, it's going to skip it, and it's going to leave that in the folder and in the audit log, and it's going to say, I skipped those today because you haven't given me permission, or you haven't taught me how to do it. And training each document, once you're used to it, it's a couple of minutes per document. So it's not a massive amount of time. So I'll pass back to Sanj just to run through this again and go on mute.
Are you able to just to go back a touch, just to show MyBotGP? I just wanted to bring everyone's attention to. I think you said this earlier, James. So again, just here, that's perfect. So if you just pause that now, coming back to Docman, you can see here that one can schedule MyBotGP to run at any interval, at any time frame that you choose. You simply select the days, and again, most of our clients are running it 7 days a week. But coming back to what MyBotGP is all about, if you can see in the top left-hand corner, I've I've selected the Docman product. Now one can select the pathology product, the prescriptions product. And if you think of MyBotGP as a one-stop shop automation platform, you're able to schedule MyBotGP to run different tasks throughout the day. So, for example, 9 to 11, I want you to do my Docman filing. Between 11 and 2, I want to do my pathology filing, etc., etc. It's got a global view of all the tasks that you want it to do. You simply log into that platform based on the product that you've bought. You can interchange within those products, but you have one schedule. So it's almost like you've got a helper that will action tasks throughout the day. So just come back to Docman. So for Docman, I've selected to run now, and it's gonna obviously log on to Docman. As you can see, when it's in flight, it has a running status. So James, you can play it now. That'd be great. It's got a running status, and what's really good, it's giving you kind of an indicative measure of what it's doing. So it's telling me, hey, look, I'm logging on, I'm clicking onto the filing button, navigating to the inbox, processing the documents. It's giving me a running count of commentary as to what it's doing. And again, there's no fireworks there. It's pretty much as per what a document filing process looks like. It's going to pick up the E&T letter, it's going to read that letter, it's going to navigate it, it's going to extract the NHS number, it's going to validate that NHS number, it's going to populate all of the fields that we've told it to based on the training, complete the filing, move to the next document, etc., etc.
Obviously, that includes setting tasks and reviews
100%.
Based down to letter
based
type.
on document type, exactly. However you want to file that letter type, and again, it can be different actions, as James said. You might want to put tasks for emergency type letters or mental health letters and things like that we see. You might want to put it to specific people, departments, etc. So you really just have a think as to how you want to file. Once you've done that, you simply train MyBotGP and it will action it accordingly. And again, at the end of the day, at 5 p.m., MyBotGP sends a status to an email distribution list to whoever you want, and it gives you a very full, comprehensive list of the metrics of that day, broken out by document type, and again, all details, the complete footprint as to what it's done for that day.
Thank you, Saj. So just coming back to this presentation that we went through before. So I always like to quickly, are there questions? Okay, I'll skim through this really quickly and then we'll get to the questions. So now, if you look at this presentation again, after having seen the demo and the description, hopefully this should start to answer some of the questions. It's around, how is the tool validated? Does it have a recognized NHS certification? Yes, it does, DCBO 129. It's bespokeable at practice level, so you are not being asked to reinvent the wheel unless you want to. You can set your own protocols, reviews, send the letters where you want to. If it's acquired at a PCN, everyone has their own copy. They can bespoke it as they like. The business case, which we touched on, this is now out of date. We're up to about 120 letters a day for an average practice at 8,500. That's 37,440 letters per year, based on a 6-day week. We've halved that for a Saturday and a Sunday, that you are currently manually picking up, validating, completing a template, and triaging to the appropriate person. That's the piece that MyBotGP will replace for you. Currently, somewhere in the region, put that at 1,900 hours per year, physical time and cost, free experienced staff. It connects directly to Docman. It can read everything in Docman. It can even read NHS emails. If you're receiving, well, not if, for those of you that are receiving letters by hand, you can scan them into Docman and it will also look after those as well. It will complete the template for you. It will work with IntelliSense and supersede IntelliSense, and you can bespoke as you like and triage as you like to the appropriate people. And it will run whenever you like. You can set it to schedule to run when you like. Full audit log now, which is one of the good things about starting to use this type of technology. No more mystery around why letters were coded in a particular way. Sometimes you will have a physical audit log of every single letter and the rules that were applied to that letter in order to get it onto the system and triage it and file it. This is sent to you every day. Every day it will also tell you what letters it hasn't seen before and ask you if you want to add them to the system. It will pre-populate about a minute to 2 minutes, agree, get it in. Next time it sees that letter, it won't ask you. So the sooner you get through your letters, the quicker that it will, the more value it will add. Annual subscription, unlimited pages, unlimited type. Simple calculation, list times 30 pence plus 499, and fully supported. It can live hosted on a server or on a physical machine. Okay, so I'm being told there are some questions here. So I'm going to stop sharing my screen here. And then I will make this a bit bigger. And we'll go to the chat. We get to the fun part. And to understand, because it's always good for us to understand what questions you're asking. Yeah, and Sanj is saying you want the first one, Sanj? Is that what you're saying?
Yeah, I'll take that one. So letters not picked up with their same document down the left-hand side. So yeah, really good point. So what we say is we set up an exceptions folder as part of the prerequisite. So you create a MyBotGP exceptions folder. So where a document has not been trained, and as in obviously it can't process it, it will drop that document into the exceptions folder, and then that's just trained at a later point, during the day. But it allows the team to pick those letters up and obviously file them accordingly.
Okay, thank you. Next question, Sanj, do you want that one as well?
Can you take data from to pre-populate the setup to all use time? So what it does, it's the way you've trained it in terms of how the information that you've provided for it to populate per document type is what it will action. So IntelliSense, it doesn't use IntelliSense. It's pretty much it's of no relevance to MyBotGP. It will literally take the fields and the information that one has trained it within MyBotGP.
I think what is asking is if it, do you want to mute, Sanj, if it will pre-populate. Yep. So yes, it will pre-populate. I think what you're asking is in the same way that IntelliSense will pre-populate the letter in advance to give you a heads up.
That's exactly right,
yeah. So yes is the short answer. What it does is it will read all of the letters and it will pre-populate in the MyBotGP panel its interpretation of that letter, and then it's simply a question of you looking at that and validating, or maybe making a couple of tweaks, pressing save, and the second time it sees that letter, it won't ask you because it's already been taught. It will just whiz through the system, and that's one of the USPs. It will pick it up, validate it, file it, triage it appropriately, and you will have an audit of that in the audit log each day. Same principle. And the next question, I believe, Sanj, I don't know if the letter has it.
So if this is in terms of a new diagnosis, this doesn't do the new diagnosis. This obviously does the administrative piece, whereby it picks up the letter, confirms the NHS number, puts it to the rightful place in terms of department, person, create task, etc. And then it leaves the actual if I've read this correctly, that diagnosis piece for the team to do.
Yeah, I think so. Yeah. Validates the letter, codes the letter, triages to the appropriate person. That's the point. So if you have a team of people there where they are doing the entire process, or for those of you you will have people doing the entire process, they won't be doing the entire process anymore. They will only be actioning the letters that you've deemed they need to action. So what that means, if you reverse think that, stuff that you want to go to the pharmacy team, if you're linked with a prescribing team, will go directly there. Letters that you don't need to look at for whatever reason will be filed. You don't need to look at them, and then the remaining letters will be coded onto the system and triage to the appropriate folder, as some of our clients have multiple folders that different people have access to. Some have one that everyone's got access to, and others distribute to appropriate people and folders and teams. So you can set it up to do that as you go along. Next question I can answer. It needs its own computer. Yes, it does. it does need its own computer, needs to be left alone, and that can be hosted machine or a physical machine. However, if you take additional products from us, they can go on the same computer. So that computer could do pathology filing, Docman, or pathology filing, Docman and repeat prescriptions, or but it does need its own machine to be left alone. That guarantees it's got a clean audit trail, and no one interrupts its work. Can it pick up urgent 2-week wait letters and code? So Arden's template. Sanj, do you want that one? You look
Yeah,
like you want that one.
100%. Yeah, so it'll pick up any letters, code them, and then yeah, again that will be a precursor for your Arden's template. So yes, it will.
Next question. Yes, yes, that was. It can run as the same as the results filing program. What we do is schedule them to run at different times. We'll work out quite quickly how long each one needs to run and how many times a day to make sure everything gets down to 0 each day. How will it know which clinician to send a document to? We usually use usual GP, so not by letter type, but by the patient. What happens if a clinician is not in the office? So again, if I understand that correct, that question quickly, you'd need to think about how you distribute the letters. So there might be a slight change in your process there in how you distribute the letters. We have some clients, whilst I don't know the exact detail, but in similar scenarios where they start to create folders for people to access, and the letters are distributed to those folders. Can you have a copy of the recording as you missed the demo? Yes, we will share. This is recording. We will share this afterwards, and there'll be a link to an order page as well. How does it know when something needs to be actioned on a letter? Same way that you would when you look at it and file it and get it onto the system and validate it and triage it to the appropriate person. You'll set up the same rule set. And of course, in scenarios, I don't know, mental health letters, by example, you'd always triage those to the appropriate team to validate and highlight them. So nothing would change there. Think about it as a person you've employed that's physically just going to blast through the letters every day, get them all onto the system, coded, correctly validated, filed really quickly for you, so you can focus on the final place. Can a letter be sent to more than one place? I've never been asked that before. Sanj, can that happen?
No, it says one rightful home because it's one classification of that letter to one department, one tag, task, rate review, etc. So no.
Okay.
But you can create it under a generic task if multiple people need to view it. So there are ways that you can create it at a department level. So within the folder.
Like a folder.
Yeah, exactly. So there are ways. I think as we're sort of saying, there may be a tweak of processes, but you'll get to the rightful place in terms of the time saving. But so it's just about sort of re-engineering, maybe perhaps slightly.
Yeah. So in my head, again, without knowing the detail of how you do things there, folder, different people can access that folder. Exactly. So in terms of time frame, how long would it take to clear 3,000 letters? Just leave it on. It's normally about 30 to 45 seconds. Sanj, is that roughly?
Yeah,
approximately per letter?
Tops a minute. Again, it's always based on internet speeds and time and system speed and stuff. But on average, it's about up to 45 seconds, roughly to a minute.
Yeah. Things like time.
I was just about to say, yeah.
Yeah. So things like time and speed aren't that relevant when you start to use automation tooling, because it just runs all the time. So after a week and of doing one letter to the next letter to the next 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 24/7 365 with no gap, even if it took 30 seconds or 2 minutes a letter, obviously within reason, then generally speaking it would just blast its way through them. As mentioned before, we use usual GP. Are you saying each GP will need a folder for it to file to them, the group, or a staff member would redistribute if the usual GP is not in? I think what we're saying is it's up to you. I think whichever approach would be best for you, but either or is possible. You can create separate subfolders and then give different people access to folders. So either or. Okay. So if a hospital discharge letter needs medication issuing and coding, we send to 2 different folders. How will this work? You can distribute it again. It will go to your team. So this is the important part, that the final sweep is done by a person. So you would pick that up and you would action it in the same way. What MyBotGP is doing is picking up everything, validating everything, getting it onto the system, coding it where appropriate to the best of its ability, and triaging it to the appropriate place. And in the appropriate place, there will be humans with experience who now have time or have because they've been given time back to send it to 2 different folders, perhaps, or create a different task. Do you have any more questions? Are we able to trial this as yes, yeah, we do offer paid trials, which we can talk about after the call. We can also book up more calls and show you more in-depth demos and talk in more detail to help. I think in summary, when you think about the MyBotGP range, they're quick to download, they're bespokeable at practice level, and they're not there to show you that they're not enforcing you. This isn't the system saying this is now what you're going to do with your filing, or if you took pathology, this is now how you're going to file your pathology test based on someone else's remit, or repeat prescriptions. This is how you're going to authorize based on someone else. Not in the slightest. Our tool is a quick download, and you bespoke it at practice level with drop down menus. So the levels to which you get it to support you are completely defined by you. A couple more questions. If there is an issue on the IT side, yes, very much so. We're very quick to respond. If you buy 2 products, do you get a discount? We generally don't discount because our pricing is lean and they're good products. What we would do for clients that take more than 1 product is we offer more training, more support. We prefer to help in that way. So whether that's a discount or not a discount, it's a thank you from us for taking more than 1 product, and not that we don't help clients to take 1, but we'll help you more if you take 2, and even more if you take 3. Okay, I think that's all the questions. Good questions today. Thank you for everyone. Okay. Do we have any examples of where the impact of the product has benefited the administration team? Yes, we do. Yeah, save time, 100%. We have references. Essentially, what it's done to the administration and support teams is it's removed that function, that piece of work from them. So they are only focusing on the light bit. On the last piece, we've had other clients whereby they've lost staff members who've retired or moved on, and they've been panicking around how they can keep the capacity to process the letters with fewer staff members. And obviously new people are difficult to recruit and often take time to train as well. And obviously training, one of the things people don't realize is, or they forget about, is even training new people takes time as well. So if you've got someone that's got more work to do because someone's left and you take someone new, that person always, not only have you lost that person, you've lost an element and a portion of time in that person who's training them in the capacity that they're doing as well.
I was just going to add, I think having sat on a lot of the second and third calls with clients, one of the main things that comes back is the ability for the tooling to get the letters assigned to the patient, clear those backlogs, which is what the clients that we have, that the practices that are struggling to clear backlogs. So I think just having that real time ability to have those letters come in and assigned to the patients on that same day is a win. As well as obviously all the administrative time savings and so forth, and protecting yourself from absenteeism and things like that. So that's just one that common theme that comes through, is that real time assignment to patients.
Brilliant, thank you, Sam. So I've got one more question's popped in, and then I think we'll round off. How long does it take roughly to train the system? it depends how you quantify how long. It's about a minute, sometimes 2 minutes at the beginning per letter. Once you're up and running, we have some clients that allocate one person to it pretty much, not full time, but they spend a good couple of hours on it a day. We'll support and get the first 20-25 letters on, and we have other clients that may want to add in 4 or 5 letters a day over a longer period of time. So it depends how much. I keep saying the same word, time. I must have said time 20 times on here. It depends how much time you have available and who's going to be doing the letters. But if you spend a bit more time getting them onto the session, it will be done quicker. But from a processing perspective, we're quite a light touch. We don't need any of your time to install the product. All we need to do is to have access to a computer, plug it in and download it. So there's no physical real impact on that team there. Then we run some training, but we'll do the training at the same time as coding some letters in, so you get time back there. And as you just put in there, Kim, yes, we're very happy to set up the first 25 letters to begin with, and we'll do those with you, so you can physically see us do them at the same time. And maybe you do, after we've done 10, maybe you do one, we do one with us watching, and you can get it quite quick to a minute, down to about a minute a letter. We'll pre-populate it, show it on the screen. Brilliant. Thank you. Thank you very much, everyone.